My name is Mark Huber. I grew up actually in 4 different places all around the country, mostly in Mississippi and Georgia. I then went to college in Maryland, medical school back in Georgia, and finally did my medical training at Mayo Clinic over in Rochester. I've been here at Avera for the last 19 years. Well, becoming a doctor was always something on the radar. It combines the ability to take care of patients and see people, along with the very interesting scientific aspects, in particular for cancer care. The best advice I got in medical school was go into the field you like to read about, and I think without a doubt that's the blood and cancer disorders, so I'm glad I made that choice to do that. Usually the interactions with patients, obviously that's vital, and quite arguably and probably most likely the central aspect of how you treat a patient is just in the conversations with them. Ultimately, that old adage about treat them as you would a family member is completely true. You certainly want to always respect their opinion, hear what they have to say. Most importantly, just, be as open and honest as you can. It's just like you would with a family member, no different than that. Practicing at Avera has been really a godsend. I think it's been, overall definitely a big positive. I think the advantages is that you can practice big city medicine, quote unquote. Get that right here in Sioux Falls, and for people who live in and around Sioux Falls, I think that's a big blessing, a big improvement to not have to travel to Omaha or Mayo or Minneapolis or beyond to get the care that's available right here in town. For hobbies, well, I do like to exercise. Run is kind of, I guess, the main thing. Certainly not as fast as I used to be, but nice to get out there and break sweat. Otherwise, family, 3 kids, that pretty much takes up the majority of available time. So, those would be the main things.